finishing up with Chapter 4, Objective 6, Interpret the Meaning of Abbreviations Related to the Integumentary System. Again, you can view all the abbreviations in one of the last tables in your chapter. So here they're asking you, can you identify the abbreviations by their definitions? Grape-like clusters and twisted chains. And so to be a little bit more specific, it would be berry-shaped in grape-like clusters or berry-shaped in twisted chains. So hopefully you're answering staph for staphylococcus for grape-like clusters and strep for twisted chains. Next are some abbreviations that not only come from this chapter but from previous chapters. So hopefully you remember that RBC is red blood cells, which mean erythrocyte. WBC is white blood cell or leukocyte. BCC, basal cell carcinoma. SCC, squamous cell carcinoma. BX, and I'm going to go by the book's definition. It should be little b, little x, so I apologize, I did not correct that on the slide, for biopsy. And then MRSA, MRSA, for methicillin-resistant Staphylococcus aureus. Continuing with Objective 7, we're going to apply medical language in clinical context. So we're going to read this scenario. Again, it is in your textbook as well. So, Emily visited the dermatology clinic because of pruritus secondary to dermatitis involving her scalp and areas of her elbows and knees. A diagnosis of psoriasis was made. Eczema, scabies, and tinea were considered in the differential diagnosis. An emollient cream was prescribed. In addition, the patient showed the dermatologist the tender, discolored, thickened nail on her right great toe. Emily learned she had onychomycosis, for which she was given an additional prescription for an oral antifungal drug. So now we're going to answer just 3 questions about this scenario. Again, you can open your book to the scenario and then I'll show you the pictures here. So the first one is actually true or false. So Emily sought medical attention because of A, an eroded sore and inflammation of the skin, B, itching and inflammation of the skin, C, itching and thickness of the skin, D, an eroded sore and thickening of the skin. Again, if you need to just pause it and read back through the scenario, that is perfectly fine. But hopefully you chose B for itching and inflammation because she has pruritus. And then inflammation of the skin would be dermatitis. True or false? An inflammatory disease of the skin involving subcutaneous glands and hair follicles were considered in the differential diagnosis. Again, differential diagnosis is just another term for other possible diagnoses the doctor could have given to the patient. And so they're asking, was it inflammatory disease of the skin involving subcutaneous glands and hair follicles? One of those options, and no, because that diagnosis is for acne, and acne was not one of the differential diagnoses that was listed, so 2 is false. And then 3, Emily was given an additional prescription for an abnormal condition of fungus in the what? Sudoriferous glands, hair follicles, sebaceous glands, or nails. And again, hopefully you chose nails because she had onychomycosis, which is the abnormal condition of fungus in the nails. And that is it for Chapter 4. Now you can go to eCampus and complete the assignments.